Well, just minutes ago, you heard how important it is to screen for genetic diseases. And one of those diseases in particular used to be a death sentence. Used to be being the optimal phrase.
Right now, 30,000 people have the disease known as cystic fibrosis. It's a condition that gives those inflicted with it a life expectancy of only 37 years. But groundbreaking research involving a medication made up of 2 drugs could mean much longer lives for more than 15,000 CF patients.
Ashton and Lola Ferguson look like healthy kids, but jumping on their backyard trampoline is part of their therapy.
Rattles their lungs around, it shakes them up.
And their mom, Jennifer, plays an active part in the treatment.
Okay, now give me some huff coughs.
Both 12-year-old Ashton and 7-year-old Lola have cystic fibrosis. Each day they spend at least an hour connected to a machine that helps loosen the mucus in their chest. Their gene defect clogs up many vital organs.
Their lungs get dried, and so the mucus gets really thick, and that's where the bacteria breeds.
I take about 35 pills a day.
Advancements in medicine mean people with CF are living far longer than they used to. In the 1960s, most kids died by the age of 10. However, both Ashton and Lola know they may not live past their 30s.
My daughter the other day was talking about having children, and she goes, well, if I live long enough.
But Jennifer is more hopeful than ever before that her children will outlive her because of a medical breakthrough discovered in a lab.
Well, we're excited every day to come to work to try to find these medicines for these patients.
Paul Negulescu is vice president of research for a pharmaceuticals company where scientists have developed a tiny pill that could be the huge miracle drug which extends the lives of CF patients by decades.
It's currently in human trials. It's in the final stage of human trials, which is what's so exciting.
Used in conjunction with the drug already approved by the FDA, the new drug is designed to give the majority of CF patients dramatic relief.
It gives the kids and the families hope.
Nearly 60 years in the making, the Cystic Fibrosis Foundation has been raising money to search for a cure since 1955.
There's little to no government funding for cystic fibrosis research, so we are involved in every single drug that comes out.
I think that we can get a cure for this.
The new drug would technically be a fix, but families say this miracle of science is the closest they've come to a cure.
It means less pills, it means better digestion, it means bigger, healthier lungs, it means a longer lifespan, it means being able to have kids, it means a lot of things.
Now, if this last phase of clinical trials goes as planned, this life-changing drug could be in the hands of patients within the next year. Another area where scientists seem to be making progress is with lung cancer. And while there's still no cure for the disease, there is hope. Allow me to introduce you to 35-year-old Tabitha Morgan. Tabitha, a non-smoker, was diagnosed with stage 4 lung cancer just 5 months after giving birth to her baby girl, Sophia Rose. It's that little girl and Tabitha's husband, Tim, who inspire her to do whatever it takes to live as long as she can.
I definitely feel like there's a war going on in my body. I hurt. I'm hoping to be able to breathe better. And live, a little bit longer to be a mom to my baby girl. I didn't know you could love somebody so much. And she's the reason why I want to keep fighting.
The Morgans say while they know there is no cure for Tabitha's cancer, she will continue to be positive, fight gracefully, and make the best of the rest of her life. The only thing I'd say, that graceful fight includes 2 plane trips from Alaska to Colorado every 3 weeks. Also that Tabitha could be part of a clinical trial.
You know what? If I were in her shoes, I believe I would do the same thing. Yeah. And in fact, there is a one-of-a-kind cutting-edge clinical trial happening right now in New Orleans that's giving hope to cancer patients. Doctors are now testing a new drug for lung cancer that specifically targets the genetics of each tumor. For nearly 3 years, Constance Heaphy is surviving lung cancer that spread through her lymph nodes.
So far it's gone. It's gone because I did go through the chemo, and then after the chemo, then you go through the clinical trials to make sure that it stays away, that it doesn't come back.
She went through standard treatment, but then she qualified for a clinical trial at a cancer research center. Here, doctors are working the latest state-of-the-art science and testing new ways of killing cancer cells. Constance is trying a vaccine to help her immune system fight off any cancer that may come back.
I'm fine. I feel great. Haven't had any side effects, anything. I mean, you know, it's been a good experience.
And now researchers have been asked by a group of pharmaceutical companies and oncology groups to be one of the first sites to test another new treatment for lung cancer.
It is designed so that if they are diagnosed, they're receiving treatment, it provides them another opportunity in the event that they would progress further.
LungMap is a new clinical trial, and like all of the treatment studies, is free for patients who qualify. In this one, the specific genetic makeup of your cancer cells would be tested, and then you'd get one of the personalized treatments targeted to your tumors.
If your doctor felt like you needed something or that there was a chance that you would progress, then you need to contact us, and we would evaluate you for the clinical trial to see if you were appropriate.
And clinical trials are also happening right here on Delmarva at the Richard A. Henson Cancer Institute. And I don't know if you know this or not, Jimmy, but PRMC joined the Johns Hopkins Clinical Research Network back in 2011. That's great because they say that gives patients more access to innovative therapies and outcomes while allowing them to do this research right here in their own local communities.
Coordinated effort always works out the best.
Absolutely.
And one of the greatest ways to maintain your health is to stay active. Delmarva Life's Sean Stryker has just the idea to do that. Sean?
I sure do, Jimmy. Anybody up for riding a couple miles this weekend? How about 100? It's the 26th annual Seagull Century coming up. I'll tell you more about it and some of the local organizations it benefits.
Plus, we're in the Delmarva Life kitchen whipping up a perfect seafood dish to work off. Pan-fried rockfish with an oyster cream sauce. Stick around. Delmarva Life, we'll be right back.